Okay, so section 2 on Alzheimer's disease. What we know about Alzheimer's disease is that it's an irreversible, progressive brain disease. There is no cure, there is no known cause, and it is plaques and tangles that build up around the nerve cells. Alzheimer's slowly destroys memory and thinking skills, and then it eventually destroys the ability to carry out even the simplest of tasks. We know that the cause is unknown, and if you have a family history of Alzheimer's disease, then this will increase a person's risk of developing the disease. More women than men have Alzheimer's right now. Alzheimer's disease usually occurs after the age of 60, and the risk increases as you get older. So nearly half of persons aged 85 and older have Alzheimer's disease. There was a German physician named Alois Alzheimer in 1906, and he did this autopsy on a female's brain who had this unusual mental illness that she died of. When he did this autopsy, he found these plaques and tangles present. So there is, what they're finding is that this damage to the brain can actually begin 10 to 20 years before you even notice problems of Alzheimer's disease. It begins in the hippocampus area of the brain, which is important for learning and memory, and then it spreads to other areas of the brain. And there's a really good video you can watch that talks about what is Alzheimer's. So make sure you take the time to look at that video on D2L. As the nerve cells die, the brain shrinks. So this picture shows you a healthy, normal neuron forest. And then this shows you plaques and tangles. This shows you a healthy brain versus an advanced Alzheimer's brain. So you can see with the healthy brain, it's much bigger. The advanced Alzheimer's brain, as the neurons die, the brain cells or the brain size will shrink. There's a video that's what is Alzheimer's. It's on the D2L tab under Unit 13. Make sure you look at that. And then signs and symptoms of Alzheimer's, we know that there's some memory loss, personality changes that are included with that. I've given you the stages of Alzheimer's disease handout. You can also find this in your book on page 402. Know the different stages. This is going to be really important. You're going to have questions on the quiz that are going to require you to be able to apply your knowledge of the different stages. What does mild Alzheimer's look like? What does moderate Alzheimer's look like? And what does severe or late stage? So think about that. I'm also going to post the bookcase analogy on that D2L. You need to watch that. That's a really, really good one. It certainly helps you to understand what's happening in the brain. Remember that there are 5 basic needs of people with dementia. They need to feel useful. They need to be able to care for others. They need to have their self-esteem boosted. They need to be able to give and receive love. And they need to experience joy and laughter. These are all so important of everybody, from babies to elderly and everybody in between. These are basic human needs, but even people with dementia need them. So let's talk about some quick behaviors that are associated with Alzheimer's disease and dementia. Remember, all behaviors are associated with Alzheimer's disease are viewed as attempts at communication, and they are usually related to an unmet need. So if they are having a behavior, you should be asking yourself, what are they trying to tell me? What is their concern? What need is not met that we need to be figuring out? So wandering is when they are walking around looking for something, don't really have a purpose, don't know where they're going, and they may not be able to find their way back home. Their judgment can be poor. They can't tell maybe that it's cold outside, or they're not dressed appropriately. So there's a good video I posted on wandering. Sundowning, that's when they have increased confusion at dusk. And this can relate to them being tired or hungry, Poor light and shadows, being afraid of the dark. There's a video I posted on sundowning. Hallucinations. This is seeing, hearing, feeling, smelling something that is not real. Sometimes this is caused by impaired vision or hearing. So hallucinations is different than delusions. Delusions are false beliefs. Okay, so hallucinations, we talked about that seeing, hearing, smelling something that's not real. But delusions are when they believe something that's not real. So like they're going to throw me out of my house. They're trying to kill my cat. These are delusions. These are false beliefs that a person might have. Catastrophic reactions. This is extreme responses, often that occur from too much stimuli. A person reacts as if there's a disaster or a tragedy. So if they're too stimulated, they may cry or scream or become very upset. Agitation and restlessness, they can pace, hit, yell, and there's lots of causes for this. So once again, we need to be looking at why are they acting in this way. Abnormal sexual behavior. We need to make sure that we don't scold a person if they're having abnormal sexual behavior. They cannot control this. They may mistake someone else for their partner. It could be that they are touching themselves in their genital area because they have poor hygiene, or there's an infection, or they've been incontinent. So we need to look at this as not them being a dirty old man or a woman, but what is a need that needs to be met for them. Inappropriate social behavior. This could be like cursing or yelling or name calling. Remember not to take any of this personally. If they call you names or whatever, it's something that's outside of their control. Look for the cause of the behavior once again. Pillaging, rummaging, hoarding, that going through somebody's belongings, collecting things, putting them in a special area. Make sure you're labeling belongings so they can be put back where they need to be, or give them a drawer that they can pillage or rummage through. Repetitive behaviors, this can also be called perseveration, and I have a video posted on that, I believe. And that's where they repeat motions or words over and over. Usually they're harmless acts. Sometimes that can be soothing for them. Just kind of be aware of that behavior. Currently, there's no cure. We've already talked about that. In the end stages of Alzheimer's, we have to remember that skincare is very important. Safety is important. Good alignment. Think about infections from poor hygiene, and what can happen from inactivity or immobility, because a person in end-stage Alzheimer's is typically going to be bedbound because their body is shutting down. So from not moving, they can be more at risk for pressure ulcers and pneumonia.